Good afternoon, everyone, and thank you for joining us for this town hall meeting. We're going to be focusing this afternoon on our businesses, but before we get into that, I'd like to provide a little bit of an overview of some of my concerns, some of my thoughts, and then where we are in this crisis. Believe me, I understand some of the frustration and the anxiety a lot of folks are feeling out there, but all in all, East County, you're doing a great job. You're complying with the health orders, and the numbers show that. And I'll share a little bit about that in a minute. But let me just say, in terms of our economy, we're facing two crises. One is the COVID crisis, the healthcare crisis. And I think everybody understands now how to be safe when you are at home, when you go out of your house, and why you can go out of your house and when. But our health crisis is firmly on the backs of our businesses. Our economy depends on it. So they both come together. One crashes, the other crashes, and what we're trying to do is hold up both at the same time. So what we did today at the Board of Supervisors is we're asking, first of all, let's open up our recreational areas as a region. But to do that, we need all of the city's cooperations to open up the parks and the trails and the beaches. In the county, our trails have been open and a lot of our parks, but regionally, they have not. So that's being worked on. I think you'll hear some news on that shortly. On the business front, I think we have some relatively good news while we work on opening up businesses. I'll talk about that a little bit later. But let me tell you a little bit about my concerns in terms of where we are. Even though some of the numbers are looking pretty good, the trends not so good as of the news today. First of all, I'm concerned about the testing. Right now, we're testing throughout the region, probably about 3,500 a day. It's not enough. There are three things. We need to be able to test everybody that we want to test and need to test. And secondly, that leads to the tracing of those individuals that test positive and then the isolation element, those three things. I'm also concerned about our hospital capacity. One of the main reasons that it's so important to comply with the health orders is to make sure that our healthcare system is not overloaded. We have people out there, not only do they have COVID and need hospitalization, but they also have other things like heart attacks and other needs to go to the hospital. And we want to make sure that there is space in the hospitals for people who need that too. So we're watching very carefully our hospital capacity. We're not there yet, but the report today from Dr. Wilma Wooten was all told throughout the county, and it varies from hospital to hospital, but we're about 68% at capacity. We're expanding that capacity at dorms in UCSD and Palomar Medical Center, but we don't know ultimately what we will need yet. But we're preparing, and we're preparing for a surge in the COVID. So hospital capacity is concerned, and keep in mind, even with these numbers you're looking at, that does not consider elective surgeries. There still is an order not to do elective surgeries. And I know that there are a lot of people out there that are feeling some pain and some hurt because they need the elective surgery. So the hospital capacity, elective surgeries, that's all a concern. And our healthcare workers, those that are on the front lines, the personal protective equipment, the masks, the gowns, the ventilators, all of that. I'm concerned about not having enough of those, and we're doing all we can as a county to get as many as we possibly can. I'm also concerned about our economy, which we'll talk about a little bit more, and the financial impact on county services. We had a report today that our revenues are down, and they're projected to be down in a big way. At the same time, our expenditures are going up. And that is not a good trend line to have your revenues going down, your expenditures up. So no doubt the Board of Supervisors is going to have to make some really tough decisions. I think you'll see that in your cities also. Another concern I have are border issues, our southern border, and making sure that the coronavirus is not being transported in any way across our border. And we're seeing a huge impact, particularly on our South County hospitals. And how many of those are a result of border crossings? We really don't know. But there are a lot of Americans, U.S. citizens that live in Mexico that are coming across every day. So that's a big issue. So we've got the social issues of the people who need to get out, need to do something we're dealing with. We've got the emotional issues, and at the same time, we're dealing with a health crisis and an economic crisis. Along with that, I believe in the implementation of the health orders, what comes into play is a little common sense. I've heard some stories that are pretty outrageous about threats of citations to people for, I could give you an example, but I think most of you out there maybe know what I'm talking about. The orders are the orders, but like the implementation of any law, sometimes it takes a little common sense in implementing and enforcing the law. People need to feel safe. So let's talk about some of the trends now and what we're seeing as of today, and these are hot off the press numbers. The number of positives for COVID-19 today, 2,434. The number of deaths, they were up today. They're at 87. This is just for the San Diego County region. The number of tests that have been done in the region, 33,904. Sounds like a lot, but consider we've got over 3 million people in this county too, and there's probably a lot more that need these tests than we'll be able to provide right now with about 3,500 tests a day. Now, if you look at the trend lines, they've been favorable all in all, but I have to say the numbers released today are not good. There's been an increase of 109 cases, positive cases today, an additional 15 deaths, an additional 30 hospitalizations. Those are some of the highest numbers that we've seen. So while we were getting some good results on the trend lines going down, today is not a good day. So let's talk now about easing some of these restrictions in the health orders. First, we have to look to the federal guidelines, and what the White House plan identified is 5 metrics in 3 categories for the states to monitor. The White House has given the governors the authority to gauge whether or not that they meet all of these 5 metrics. And I won't go into detail, but I'll just tell you it has to do with symptoms, cases, and hospitals. And if you want me to share details, I'm happy to. But let me go on to then, with that guidance and those 5 metrics, what the governor's 6 indicators are. And I'm talking about California now, because the counties and the cities must follow the governor's orders. And for us to do a lot of what we're trying to do, and a lot of what I'm hearing, particularly from people that want to get out into recreational areas and can't right now, and most of the emails I'm getting now are from businesses that want to open. We have to look to the governor's orders and prove to the governor that it can be safe. So here are the 6 indicators from the governor. 1, the ability to monitor and protect communities through testing, contact tracing, and those exposed. 2nd, the ability to prevent infection in people at risk. 3rd, the ability of hospital and health systems to handle surges. Therapeutic research, ability for businesses, schools, and childcare facilities to support physical distancing. And finally, the ability to determine when to reinstitute measures such as stay at home as necessary. So that's what the governor has basically laid out. Now let's talk about the businesses, because that is the focus of the town hall today. And I'm very, very interested in answering some questions that have come in, and also hearing from businesses is what kind of protocols do you think you can put into place that make your business safe for people to come into? Because quite frankly, I don't think unless people feel safe, they're going to be going into a business or going anywhere. So how do we open businesses? First of all, the state of California, as I just mentioned, spells out the essential businesses. And you go on the state website, and there's a whole list of those, and I'll bet you the businesses have already done that. Governor has put out the 6 indicators that I read, and I've heard that may revisit those indicators at the end of this month, which is not too far away. A local task force has been created, which also involves the East County Economic Development Council, and those recommendations will be provided to the county and the state for us to take action. Now, I talked a little bit earlier about reopening parks and trails and beaches and oceans and lakes, and let people get out there and swim and boat and fish and hike. I know, I've seen you. You're already hiking, even though some of those areas are roped off. So I think we need to make it a little bit easier for you to do that. And the state needs to cooperate a little bit too, because we have a lot of state parks and state trails. Parks can already be open if social distancing can be maintained, and that's the key. Stay at least 6 feet away. In fact, in the county of San Diego, many parks and trails are still open, have been open, but the parking lots have been closed. So we're trying to open up some of those parking lots so people don't park along the roads, which causes some safety issues, and can park in the parking lot. I know that the Poway neighborhood parks are still open. City of San Diego just today opened their neighborhood parks. That's a good thing. And the county is working with cities on a plan for the beaches and the ocean. County does not have control over opening up city parks, trails, or the beaches. We only have control over the water, not anything else. So regionally, I know everyone is working together to try to get this done, to get people outdoors safely. Remember, though, the social distancing, very, very important. Let's jump into the business and the action the Board of Supervisors took today. In our small way, we unanimously voted on a proposal that was brought forward by Vice Chairman Jim Desmond and myself. It's a $5 million loan program for businesses, but only in the unincorporated area. That's our jurisdiction. And the partnership is with the San Diego Foundation. So who can participate in this program? Businesses must have 50 or fewer employees to be eligible for the loan, and it's a loan program, not a grant. And the priority will be on job retention and creation. So what will the loan be? The loans will be dispersed in amounts of up to $50,000. The interest rate will not exceed 2%, and businesses will have 5 years to pay it back. 5 years. So how are we going to do this? It's a partnership with the San Diego Foundation, and there are other partners that are working on the mechanism and the application. We're very hopeful that in May, which is just a couple of weeks away, that we will have an application, have the process set up so businesses can start applying for the loans. Businesses in the unincorporated area under 50 or fewer employees. And then we're hoping in June we'll be able to get the money out there to the businesses. So that's where we are on that. More details to come, and we'll be posting on our website, and we'll get the word out. Business right now, though, are able to fill out an initial interest form, not the actual application, but an interest form, so that the foundation can build a lead list and stay in contact with those who are interested. So let me give you the information on that, and you can visit www sdfoundation.org, or that's the easiest, or San Diego sbnlp.org. And with that, I'm going to introduce a very important person who is very involved in the business community and done a great job, James Sly. James is the Vice President and the Chief Operation Officer of the East County Economic Development Council, and he's also, though, the Director of the San Diego and Imperial Small Business Development Center. So James is going to bring you up to date on some other opportunities that are out there for businesses. And I just heard today that it looks like the federal payroll protection program was acted upon by Congress and includes over $300 billion for businesses in the country. And so those that have applications in or want to can apply for that too. So James, and I know Jo Marie Diamond, who's President and CEO of East County Economic Development Council, is available too for any questions. But James, at this point, I'm going to turn it over for you for some more opportunities for businesses.
Yeah, right. Well, thank you, Supervisor Jacob. I hope you guys can hear me okay. I apologize as I look at her webcam. It's obviously a lot brighter than mine. I hope I'm leaning forward enough so that you can see me. But my name is James Sly, and I am with the East County Economic Development Council, and I am the Center Director for the SBDC in East County. So I don't oversee the whole network. There are 9 locations throughout San Diego County and Imperial. I just oversee the one in East County. But hopefully today I'll be able to walk you through some of the resources that are available to the small businesses out there. And just a quick background, the Economic Development Council and the SBDC work hand in hand on a lot of the projects that affect most of our East County entrepreneurs. On the Economic Development Council side, we work on things like housing, traffic, workforce, education. And on the SBDC side, we're really tasked with supporting small businesses through all of the challenges that you guys face every day, from hiring employees to getting the right permits to, in this case, finding financing. And so hopefully I'll be able to sort of showcase some of the resources available. Since March 16th, when this pandemic sort of took off, my center in East County has already met with over 250 small business owners and entrepreneurs. We've had more than 520 counseling sessions, which are essentially one-on-one advising sessions where businesses can come in and ask for help filling out a loan application, or furloughing their staff, or devising a new website, or writing a new business plan. So there are a bunch of resources all available to you at no cost at the SBDC, the Small Business Development Center out in East County. And we're usually hosted on Lexington, actually, in El Cajon. Obviously, though, now all of our staff are working remotely, so all of the workshops and counseling sessions that we offer are available via webinar online. But today I wanted to talk a little bit about some of the clients that we've been meeting and some of the challenges they've been facing. I'm sure that many of you are running into sort of similar scenarios. We've, again, in meeting with those hundreds of clients in the last month, we've seen restaurant owners that haven't been able to stay open, haven't been able to accept clients. We've seen them slowly transition towards takeout and delivery services as they look to sort of keep that income, at least moderately stable. We've seen manufacturers who have changed from producing aerospace parts to now producing hand sanitizer and personal protective equipment. And we've seen, really a whole host of adaptations as our small business community tries to stay active, tries to stay alive. I know that for many of our clients, this is a very scary time, a very scary period as they look at, the downturn in income, the downturn in customer volume. And it's really our job to try to sift through the hundreds of emails, the hundreds of news broadcasts you hear about COVID and the CARES package and the SBA loans, and try to distill that down into the simplest steps you can take to access these resources. So I'll give you one website address, one URL where you can go and get all of the other URLs to track this information instead of reading you off 20 of them. But if you go to our website at eastcountyedc.org, halfway through that page, there's a call out button that you can click on, and it will take you to instructions on applying for the Economic Injury Disaster Loan, the Payroll Protection Program, the Pandemic Unemployment Assistance, and some of the most frequently asked questions that businesses have or the Treasury Department as they're sort of moving through these applications. But you heard Supervisor Jacob mention that we're expecting the economic injury disaster loans and the payroll protection programs to become active again. You know, they were fantastic loan instruments over the last month. They've done a lot to help support small businesses, but they did such a good job that they ran out of money. And for the last week and a half or so, businesses haven't been able to access those resources. So as this legislation moves through Congress, it's expected that these programs will receive another sort of allotment of funding, and they'll be available to hopefully all of our San Diego businesses to take advantage of. But real quick, the differences between the two programs, because we get these questions a lot, and I want to make sure that everyone has the information they need to apply. The two programs that we're talking about are the Economic Injury Disaster Loan and the Payroll Protection Program. So really quick breakdown, the Economic Injury Disaster Loan is up to 3.75% interest rate. It's available to any small business. That includes self-employed individuals, independent contractors, sole proprietors. It even applies to 501c3 nonprofits. So the eligibility is pretty broad. Their goal is to help as many small businesses as possible. So the good part of that is that, you know, you can probably qualify. The bad part of that is there's a lot of people qualifying, so try to get your application in early. But the Economic Injury Disaster Loan, the term is for 30 years, again, up to 3.75 interest rate, and you can use it to essentially pay for really anything other than paying off your existing debt. So you can use it for payroll, you can use it for car payments, mortgage, rent. You can use it for a lot of your business expenses that you're running into. The way it works is you'll go to disasterloan.sba.gov. You'll submit your application there. And hopefully after a few days/weeks, I'll be generous, hopefully someone from SBA will call you and ask you about how much you need. They'll work through your eligibility criteria. They'll explain all the terms. I don't need to go through the spreadsheet of information available for you now, but they'll walk you through the process after you've applied. I've done hundreds of these applications. They take less than 10 minutes to do. Like I said, they're not currently available, but they're expecting to start again probably late this week, early next week, is when we expect the loan instruments to become available again. So the information I'm giving you right now, you can't log off this webinar and go apply, but you will be able to very soon. So I would encourage you to start getting your financials together, your application processed, so that you have everything kind of ready to hit the ground running when these instruments come back out. But the Economic Injury Disaster Loan, again, can be used for a variety of business expenses. They will give you up to $2 million at a very cheap interest rate, and the SBA officer will walk you through the terms and conditions that are sort of associated with it. Underneath that process, they also have the advance program, the EIDL Forgiveness in Advance, which was the grant that was up to $10,000. Essentially, it's a free grant for someone who applies for that EIDL loan. They'll give you $1,000 per employee, depending on the availability of funds and when you get your application in. But that small advance payment is one that you don't have to pay back. And you get to keep that even if you get denied for the loan, right, for whatever eligibility criteria. So my hope is that as many of our San Diego companies as possible will apply and at least take advantage of that free advance, essentially, of up to $10,000, and then move forward with their EIDL application. The second instrument I want to talk about is the Paycheck Protection Program. And this one is really designed towards maintaining the integrity of your workforce. The goal is to essentially pay and sort of prolong your ability to keep your staff employed. And it's a really fantastic instrument. The interest rate is only up to 1%. You have 2 years to pay it off. It's 250% of your average monthly payroll. And it's geared towards paying for your payroll costs, your rent, your utilities, or your mortgage interest. It won't pay the principal, but essentially it's, again, designed to ensure that owners and their employees can continue to receive compensation from their business and stay open a little while longer. So again, this one will come hopefully late this week, early next week. The applications will be open again. Most banks are still currently accepting applications and allowing you to kind of get in line to join the queue, even though the funds aren't available now, because they expect that they'll be available very shortly. So if you get your financials together, you can apply for that 3P loan through most of the online portals available to the banks now, and you'll hopefully be able to access the funding as soon as it becomes available. To apply for the Paycheck Protection Program, you'll actually do that through your bank, whoever you have a banking relationship with, whether it's one of the big banking institutions like Chase or Wells Fargo, or whether the smaller credit unions. Regardless of who you have a relationship with, any 7A SBA lender, which is pretty much everybody, should be able to accommodate your application. I would encourage you to get that ready. But that's the big sort of competitive advantage of that instrument, is that the Paycheck Protection Program, 100% of the loan proceeds will be forgiven if you spend them on payroll, right? So if you use the money that you receive from this program to keep your staff employed, to pay yourself as an owner, that portion of that loan will be forgiven. And so it's, again, essentially this is money that's on the table for our small businesses to access. And I would really encourage you to go apply as soon as you possibly can. My expectation is that this new allotment of funding will also run out, right, as people sort of look around for as many resources as they can. So I would encourage you to apply as soon as these become available. And again, if you go to eastcountyedc.org, you'll find links to all of the frequently asked questions. You'll find links to a lot of these application websites, and you'll find a breakdown, informational breakdown of all the different terms and conditions. So one other last program I should mention is that there's also some unemployment adjustments made available through the state of California for small business owners, sole proprietorships, who are usually not typically able to access unemployment. And again, information on that is also available on our website at eastcountyedc.org. So with that, I'll thank you, and Supervisor Jacob, I'll turn it back over to you. So thank you.
James, thank you very much. Great information. Let's start going to questions. We'll go first to those who sent in their questions ahead of time. Jeff, first question.
This is a health question. How do you get tested in San Diego? I don't have a doctor in the county, and the calls to the county have not been helpful.
Well, first of all, the tests have to be done or referred by a healthcare provider. So you have to go to your healthcare provider. Now, what if you don't have one? Then you need to call 211 San Diego, and they're the ones that can assist you in locating a federally qualified health center and to offer a provider in the region, because they can tell you where to go for that. So that's the testing question. Next.
So this is also related to tests. California is at the bottom 5 states for tests per million people. Why is it that low? And what are we doing to improve that?
I can't speak to California and the numbers. All I can talk about is the San Diego region and what we know with the reported numbers. And we work very, very closely with our hospital partners and other parts of the healthcare system to increase our capacity for testing. We now have a testing coordinator for the county, and we have also several areas in the county that are doing testing. We've got the county lab that does testing, we've got hospitals that do testing, and we have the commercial labs. So the county coordinator and the task force is trying to get their arms around all the testing that is currently available. And I mentioned, as much as we know now, about 3,500 a day. And then to expand our efforts. And we're not certain yet how many more we need, but that's what the task force is working on, so we can test anybody and everybody that wants a test, not just the people that need to be tested.
So another health question. As of today, compared to other countries, the U.S. has the highest number of total cases, active cases, deaths, new cases. Why is it hitting the United States so much harder than it's hitting other countries?
Well, again, that's more of a question for our federal leaders, but let me take a crack at it. I mean, if you look at the United States, we're very diverse, we're very large, and a very populous area. So what may be true for New York, where the numbers are the highest, may not be true for San Diego or California. So the answer likely is going to be a variety of factors that would be involved in that. So how's that for an answer? After the crisis response is passed, there will be many studies and reports done on the spread, and we'll have a good idea when we look back and study it. It's an after-action report that will occur afterwards, much like what we do in our major fire events.
You already touched on this, but a question going back to it. Will we be opening based on our San Diego County numbers, or are we linked to other areas of California? Will we be using federal guidelines for opening phase 1, 2, 3, et cetera?
Well, let me briefly walk you through that one again. First, the states have to rely on the federal guidelines. It's those 5 metrics I mentioned earlier. And then the governors of each of the states are going to take those federal guidelines, they call the gate criteria. And in our state, the Governor Newsom has developed 6 criteria. So we can go beyond that, but we can't go against what the state dictates. The governor is the one that will dictate the orders and define what can be open, what can't be open, what's an essential business, what's a non-essential business. So and then it comes down to the county, and the county health officer, she is the one, Dr. Wilma Wooten, she's the one that issues the health orders for the entire region. Now, cities can go more restrictive than that, but they can't go against the health order. So hopefully that helps.
There was a lot of questions during the board meeting today about golf courses, and we got several emails about this. You touched on it earlier, but why can't golf courses just open up? Why can't the county just open them up tomorrow?
Well, because first of all, the governor has defined golf courses as a non-essential business. So we need to work to change the state orders coming out of the governor's office. So in order to do that, the testimony we had today from the golf course industry, they've developed some protocols and they've gotten busy doing this. And I would urge all different kinds of business to develop their own protocols for how you could put some rules in place so it would be a safe environment not to spread this virus. But I feel very optimistic at this point that we will see some changes within hopefully a week, 2 weeks at the most, for all our recreational facilities, as I mentioned earlier, including golf courses. So stand by.
Are businesses going to be notified at the end of the quarantine by the federal, state, or local government? Will there be a list on a website for business owners to announce to customers that they are open for business again?
Absolutely. As soon as we in the county know that we can open up businesses, other areas, and to do it safely, have the protocols in place, most importantly, the social distancing requirements, then we will make sure that the word gets out to everyone. However, I'm sure you may be, if you're paying attention to the news, you may hear it from the state or the federal government first. The president gives an order, and that comes down to the states, and then the state to the county, and then the county to the cities. That's kind of the order of business.
We've got a couple questions about the business loan program for the county. One, what about businesses that are within cities? And 2, what about businesses in cities that serve the unincorporated area?
Well, the businesses, the county loan program approved today only applies to businesses located in the unincorporated area. They have to be located in the unincorporated area. It doesn't count if you're located in a city, but you do business in the unincorporated area. So, that's an interesting question. Cities, in some cities, as I mentioned earlier, they have developed some kind of a loan or a grant program similar to that. And I would encourage others to do that have the ability to do that. Having said that, the county program or the city programs, that on top of what James indicated is available, particularly through the federal programs and whatever else may be available out there, is an add-on. All of these are just trying to buy us time, keep some businesses going in the meantime until we can reduce the threat of this disease, get a vaccine, get an antiviral treatment. What we're doing here is we're buying time, and we're trying to keep, as much as we can, our businesses there in place, ready to open.
So we certainly love our chambers in East County. This question came from the Lakeside Chamber. How can the Lakeside Chamber assist the county in making sure our small businesses have a better chance of receiving county funding? How can the county ensure that funds are spread out equally throughout the county and East County, and specifically Lakeside?
Going to be first come, first serve. As I mentioned earlier, you can put in right now, a business that may be listening, fill out an interest form. Before we close today, I can give out that information, how you would apply for that. You can always call my office too. It's 619-531-5522, or email me, and we'll make sure you get an interest form. So that's one way. But first come, first serve. Those that are online today, businesses that are out there, let's get in line. My sense is there's not going to be enough money. So those that are there, how can the chambers help? How can Lakeside Chamber help, and others? Ultimately, what we want to do is get our businesses open. And we can't just say by a certain date we're going to have all businesses open. The virus has no date as to when it's going to end, or when the trend lines go down to the extent that we feel safe again and the health threat is over. So what we did today at the board is we asked our staff, hey, let's put together a plan and let's work with the business community and see what protocols, what rules we can put in place to allow certain businesses to open. In that regard, we need the help of the businesses. As the golf course industry did today, they presented protocols of what it would take for people to go out on a golf course and be safe. I would ask each of the businesses, because you're all different. There are fence businesses, there are hair salons, there's a lot of restaurants out there. How can you open up your doors and be safe, understanding the threat of this virus, how it spreads, social distancing needs, and all the rest? And provide them, send them to me, and then we'll input that into the task force that's working on this, and we're going to do this just as soon as we can. Understand the urgency.
Jump into to the homeless situation as it relates to COVID. With so many homeless camps at our shopping centers and parks, I'm worried that this will only increase the spread of COVID in our community. I've been avoiding the shopping center at the corner of Hamishaw and Sweetwater altogether. Any plan for this?
Yeah, the homeless issue is still a big issue, even though we made a lot of progress on that. I'd taken an action before the board late January, which involves solutions, short-term, immediate, long-term solutions to the homeless in the unincorporated area, and focusing on Spring Valley and Lakeside, also working with some of the leaders in that community. It involved temporary emergency housing. So there's an opportunity, and there are plenty of places right now today for people that are out on the streets to be able to get off the streets and into housing. There's housing available, but there's also, we're looking at property sites for storage services, intake activity to help people if they have mental illnesses or addiction issues. There's help out there too. All people have to do is ask. We can't force anyone to avail themselves of these services, but the services are there if people want them and want to get off the streets. The sheriff and the district attorney are also involved in this, and in coordination with all departments of the county that are working to try to resolve the homeless situation. And a lot of homeless have been tested also to make sure that we're not spreading the virus through our homeless population. there's a lot of outreach. There's public health nurses. There are teams out there. They have hygiene kits. There are hand washing stations, and there's medical attention for those that need it. So there's a lot of help out there for those that are homeless. It's a risk area, but I have to tell you, our biggest risk area are our skilled nursing facilities and our long-term care facilities and memory facilities in our county.
If it's okay, I was hoping to go to one of the Q&As that were submitted for James. James, this is from Kathy Wilder. If we've already applied on 327 and haven't heard, should we be concerned?
I'm not sure which loan you might have applied for, but essentially you're still within the window for both the EIDL and the 3P loan. It was about 3 to 6 weeks. And so originally SBA was doing a really great job as the loans first came out. The EIDL loan was getting processed in like 3 days, despite them saying it might take you 3 weeks. Obviously, as the applications ramped up, that time frame got extended quite a bit. Right now, the 3P loans are not, I mean, they're being sort of put into the queue, but there's no money for it. But if you submitted an EIDL application, if you don't hear, I would say by the first week of May, then there's something wrong there. It shouldn't take that long, but that's the longest window they've given us. Ideally, you'll hear much sooner than that.
There was another question from Anonymous. It said, what do you say to any business who are seeing a big increase in demand but are not able to capitalize because we are not able to work or ship the product?
Is that directed towards me, Jay?
I think so.
So actually, in a weird sort of foible, some of our industries are doing really well during this pandemic. There are some companies that are actually doing better now than they were before all of this sort of broke. And so it's actually not an uncommon question. There are, for example, some of our manufacturers, I mentioned earlier, some of them are transitioning to ethanol and hand sanitizer or PPE production instead of generating whatever they were making before, sweatshirts or aerospace parts. And so there are still, depending on what industry you work on, there are still third-party logistic companies that are functioning during this crisis that are still providing some of those delivery or transportation services. So without knowing really which industry you're in, I can't be more specific, but there are numerous opportunities. If you'd like some more specific advice, you're welcome to call us and schedule an appointment with one of our advisors. But it's not an uncommon question. Like I said, some businesses are obviously really suffering during this, and some are surprisingly doing very well. So,
Dianne, I'll direct this one to you. You may not be able to answer it, but from Kathleen Hedberg, how do the public health experts explain the increase in positives over the last day? Is increase in positive due from more people being relaxed or protesters, or is it because we are just testing more?
Kathleen, I don't have an answer for that, and I doubt that our health folks do either. It is what it is. What our health professionals have said to us, though, that the numbers are probably lagging, particularly the deaths that we're seeing. So, and the other thing that they've told us is if you look at the numbers, these are reported numbers. It's expected that that's not all that's occurring. Multiply those numbers by about 10, and that's probably a little more accurate in what we're dealing with in this county. When we have a better trend line in terms of what is going on, and then we may not be able to analyze all of this until the crisis is over and we do like an after action report, we may not know the answer to that question. And it's been a little frustrating because the trend lines have been going down. The proportion between the total numbers of those that we've tested versus the number of positives, but today was an exception, unfortunately. So we just need to watch those trend lines, not just day by day. It's kind of like the stock market. It's not day by day. It's over a period of time that is really going to tell us something.
So one of the first questions we got in the Q&A was, you've got two schools of thought. One is that you don't throw out an umbrella in a rainstorm because you haven't gotten wet, and also you don't burn down the village to save the village. So how do we balance these two belief systems when making a decision on opening up the economy?
First of all, any decision that has been made in opening up recreational areas, businesses, need to be based on facts. The facts are what is going to drive the decisions, not emotion, not politics. And I get the anxiety that people are feeling, particularly our businesses, and people are getting antsy in their houses. But I would just urge everybody, we're in a crisis that we've never seen before. It's an invisible enemy, and we don't know a lot about it, frankly. And we don't know what the cure is. Some people survive, particularly people that are younger and do not have underlying conditions. We do know that people over the age of 65 need to be extra careful. If you look at that age group and the number of deaths there, that's where most of the people have unfortunately passed away, but most of those have had underlying health conditions too. So we're in uncharted territory. So while we know certain things at this point, we know this is a virus that spreads rapidly. We know that people that do not have symptoms can be spreading this virus and have it. We know that it's very dangerous and can be very deadly. And we do know that it can cause after effects in the body. Heart, liver, other organ issues can be damaged as a result of this virus. So where we know some things at this point, what we don't know and we don't have the vaccine. We're probably well into a year until we get one. And then we don't have any known consistent way of treating this virus. But some people survive and some people don't. So that's kind of where we are. And I relate it back, and it's been related to the 1918 Spanish flu. I was not around for that one, but a lot of people died. They didn't know a lot about it and didn't have and do the precautions that we're doing today. I do remember the polio epidemic, and I was in junior high and high school at that time. And at that time, the kids were affected. Some of the students that I went to school with died and were crippled for life because of polio. And I do remember that we still did go to school. We weren't able to go to the movie theater, and we weren't able to go to the community swimming pool. But there weren't the restrictions then. Maybe had there been, we wouldn't have lost so many young people at that time, but we didn't know. But there was a vaccine found. Salk found the vaccine, and now pretty much polio has been eradicated. So it takes time, and people need to be patient. Everybody is suffering, everybody is sacrificing, but in times like this, it's a time where I know we pull together. We've done it before, and we're doing it now. But it takes the cooperation of everybody. A lot of personal responsibility is involved here too. And as I said earlier, I think some common sense in what we're doing, but there's no easy answer to when we open things up. It's all going to depend on the facts. And we need to keep the emotion and the politics out of it. This is not a political issue. This is a very serious public health issue and public health crisis. And it's right on the backs of our economy. And we can't solve the economy issue without solving the healthcare issue in this virus. And we'll beat it. We're fighting it. And we live at a good time. We've got great scientists. We've got great businesses. You heard James say are retooling and putting out some of the personal protective equipment and other kinds of things that we need. So we'll get there, but we all need to be together in this fight and fight it, and we will win. We just don't know when.
Just a specific question for James from John. Is one bank better than another for the PPP or /EIDL?
I was wondering if you were going to ask that. Actually, I could see it popping up in the comments to my right, but so it probably wouldn't be appropriate for me to call out one bank as better than the other, although the really guidance they've given us is that they are, at least in this first wave, the one that just passed, they were only willing to work with clients who they had a business banking relationship with. And that caused a lot of challenges for small business owners because, some of them were, they had accounts with banks that were not prepared or were inundated with applications. So in general terms, we saw a lot more success through the smaller credit unions, the smaller sort of local banks than, the big banks had a lot of applications to process through, and they obviously prioritized their clients. And they were able to acquire a lot of the funding for their constituents, for their clients. But in terms of the small business owner, the really small sort of mom and pop 5-person shops, we had a lot of success through the credit unions and through the smaller local banks, in addition to the applications the bigger banks trust too. So I don't think any one bank did a bad job, and I don't think any one bank, if I'm being honest, did a particularly fantastic job either. So I think you're sort of safe regardless of who you use. You just want to make sure that you have some type of business relationship with them, because that was their main criteria on whether they would process your application or not.
Another one, James, we'll see if you can ask. This is from a Crystal. Is the East County EDC's website helpful in navigating the EIDL and PPP only regarding financial assistance, or are there other options for financial assistance?
So the eastcountyedc.org website has just sort of a catch-all for all the links. Instead of me reading off 20 URLs here and trying to get you to type them down really quick, the EDC has sort of a catch-all for all of the referrals that we've been making out to for the EIDL application, the PPP application. There are some other financial instruments available through some of the small micro lenders like Axion and CDC Small Business Finance. So they also are offering COVID-19 financial instruments. They will probably play a very big role in the applications for EIDL and PPP that come out hopefully again the end of this week, maybe early next week. You can find a lot of those resources through that paper that's in the middle of our website. You can also use our website to schedule appointments with our advisors. If you go there, you can schedule phone calls or webinars. You can register to attend webinars where we walk through a whole host of financing options and, to be frank, other business assistance activities, right? Like I mentioned, there are some people who, given the sort of public closure, have been wondering, well, is my social media presence where it needs to be to generate traffic? Is my website good enough? Am I using the right, digital media marketing and advertising? And so we've been helping clients with a whole host of issues, but you can schedule all those appointments through our website. And you can also find access to a bunch of different, again, financial and small business assistance resources through that white page that's listed in the middle of our website.
Diane, we had one question. Why can't dog grooming be opened up also?
From my understanding, it's not on the governor's essential business list. That's another business, particularly if it's mobile dog grooming. I'm certain that there can be some social distancing put in place on that, and that may be something that whoever asked the question to get us some criteria, some protocols into how you would operate safely. And then we'll provide that to the appropriate task force that's inputting to the state and to the governor's office.
Is a question from Craig Williams. How accurate is the county's COVID-19 by zip code map?
As accurate as we can be. Again, all the county numbers are what is reported to us. What is reported to us from the hospitals, the clinics, and the other facilities in the county. As I mentioned earlier, multiply those numbers by 10, that's what has been indicated by our healthcare professionals, and that's probably a more realistic number of what's going on in the region. All you see in our numbers are what's reported, and they're as accurate as they can be.
Follow-up from John Mendoza, James. Do we have access to you for further discussion? If so, post your information.
Yeah. I was actually typing my information into the response box here, but on our website it actually has our office phone, which is being forwarded to the person who manages all of our calendars. And so if anyone has specific questions, you can call our phone number. You can actually also schedule an appointment through that eastcountyedc.org website. You can register for workshops there. You can reach out to us pretty directly. Again, any phone call you make to that number is going to forward to Danielle Sparks from our office, and she's the one controlling all of our calendars. So she'll be able to tell you very quickly when we can get an appointment scheduled. If it's just a quick question, to be honest, she'll probably just text me and I'll call you almost immediately. If it's something a little more specific or complicated or in depth, then we'll schedule a more robust appointment where we can talk about all of your financials or all of the help that you need and sort of breaking everything down more specifically. So I'll post that in the chat over here as well. But again, the best opportunity is through our website, eastcountyedc.org. It's on Facebook too, or you can call our phone number at 619-258-3670. And that forwards directly to the person managing all of our calendars.
We're going to have to wrap up. We promised an hour, and the hour is almost up. James, I'd like to thank you very, very much. Lots of great information and all that East County Economic Development Council does to help our business community. I would also like to tell people again on the $5 million loan program that the county approved today. You can fill out an initial interest form to the San Diego Foundation, and you can go online at sdfoundation.org. That's sdfoundation.org. So please, businesses out there that are listening, provide me your input. Protocols that you would recommend putting in place in your particular business. We'll provide that to the task force that's working on this, to input to the state so that the governor can revise his essential business list. And we are on that now. We will do that just as quickly as we can. And in the meantime, I would urge everybody to be safe, practice the social distancing, and make sure if you do have symptoms or you feel bad, contact your healthcare provider. Don't go to an ER unless you really have an emergency. Contact your healthcare provider. If you don't have one, call 211. And that's it for today. So if you have some ideas for me as to what you'd like to hear on the next town hall, I'd like to continue doing this as long as you feel that it's beneficial. Let me know what subjects you'd like us to cover, and we'll get the experts here to help with folks in my district. So thank you that have stuck with us this afternoon, and stay safe, be healthy, and get out there and walk. Thank you.